And greetings. This is Dr. Mohammed A Rafey. I'm one of the senior consultants in nephrology and a hypertension specialist at Apollo Hospital, Hyderabad. Today I'll be busting some of the myths that are related to hypertension, that is high blood pressure. High blood pressure is over 140/90 mm of mercury. This is a myth. For decades, we used to say that high blood pressure is over 140/90, but in the past few years, this has changed. Those who have cardiovascular disease and those who are at risk of dying from cardiovascular disease, for them 140/90 is not the number. It's 130/80. That's where we start them on treatment. The signs of high blood pressure are obvious. No, this is a myth, because high blood pressure, like diabetes, is called the silent killer, and the reason is that till the disease is advanced, you don't get any symptoms. So unless you check your blood pressure regularly, you will not know whether your blood pressure is high and you have hypertension or not. As long as I don't add too much salt to my food, I can eat whatever I want. This is a myth. It's not just adding salt from salt shaker. It is also the salt that's present in your preserved food, like pickles, papad, and the bakery items you may eat, the curry puffs. All those things have very high content of salt, and this may cause hypertension. So you have to be very careful. It's not just adding salt from a salt shaker, but also the salt that is hidden. Drinking coffee can raise blood pressure. Now, this is a myth. It can raise blood pressure transiently for some time. As soon as you drink coffee, the blood pressure may go up, but it does come down soon. And it does not affect your heart, brain, or kidneys that we are scared about with high blood pressure. On the other hand, some studies have shown that long-term coffee use chronically for many years can in fact improve the condition of your heart, your brain. High blood pressure is more common in men. Once again, partly true. The reason is high blood pressure is more common in men who are less than 50 years of age. But once men and women cross 50 years of age, the incidence and prevalence of hypertension becomes same in both. And the reason for this is there are certain hormones that are present in women during their reproductive life that keep the blood pressure down. Hypertension can only affect older individuals. This is not true, especially these days, when we find unhealthy lifestyle being followed by the youngsters. They are obese, they are eating a lot of salt, all those pizzas, burgers, they come in with a lot of salt. And so we are finding hypertension in younger individuals now than we used to in the earlier days. There is nothing I can do to prevent hypertension if it runs in my family. This is a myth. A lot of times the hypertension that people get because of their family predilection for developing high blood pressure is because of the environmental factors. Unhealthy lifestyle, if you are going to be obese, if you are going to eat whatever you want, like high salt intake, high fat content in your diet, these can cause early onset of hypertension, and these can definitely be prevented. If I am on blood pressure medications, I don't have to exercise or watch what I eat. This is not true, because there are two parts of treating hypertension. One is non-pharmacological approach, where you change your lifestyle, improve your lifestyle, start exercising regularly, reduce weight, and also have a healthy lifestyle where you are eating less salt, eating more fruits and vegetables. So this is the foundation of your blood pressure management. And over that comes the antihypertensive medications. So unless you take part of that non-pharmacological approach, you will be taking more and more medications as the time passes. If my blood pressure comes down after taking medications, can I stop taking those medications? Not true. If your blood pressure comes down, you are lucky, it is coming down. You are fortunate, it is coming down. It is well controlled now, but that's only because you are taking those medications. If you don't take medications, it will go up again. High blood pressure is not serious. This is not true, because high blood pressure can damage your heart, kidney and brain. as a result of which you can get heart attacks, heart failure, kidney failure and brain strokes. High blood pressure is inevitable with age. This is partly true because if studies have shown that if we live beyond 65 years of age, 95% of us will become hypertensive. But then there are trigger factors that can cause us to develop high blood pressure earlier on. Hypertension is curable. This is a myth. Once you have hypertension, most of the time as you grow older, the hypertension becomes more severe and you may require more medications. It is not curable, but yes, it is controllable. If I don't have any symptoms of high BP, am I safe? High blood pressure is known as a silent killer. Most of the time, people walk around with very high blood pressures and they may not have symptoms. So unless you check the blood pressure, you will not know whether you have hypertension or not. So it is important to get your blood pressure checked up periodically, and if you have hypertension, you need to be on treatment. Wine is good for heart. I can drink as much as I can. This is not true. Excessive wine drinking can damage your heart and also can cause worsening of your blood pressure. So today we have busted some of the myths that are related to hypertension. So whenever you come across some kind of these statements about hypertension, please don't believe in it. Go to your specialist, get yourself checked up and get all your questions resolved by your specialist. Stay safe, stay informed, stay healthy. Thank you and namaskar.